Hey guys, welcome back to my channel. So, oh my god, I have not even posted on this channel in like, what, a year now? I am so sorry. Like, I literally have just finished my finals. So I just thought to myself, I've been thinking about you guys like for a while now, and I just haven't had time to do anything. I barely have time to maintain my main channel, which is my hair channel. Like, I post probably like once every like 2 to 3 months, honestly, on that channel. And I haven't had time to really do anything on this channel at all, and I feel so bad. And I told myself once I finish this semester, I would totally at least make a video to try to update you guys. But like, honestly, I'm just catching up at this point. Like, this break, if you want to even call it that, is me just catching up. So as you can see, I am cleaning my bathroom, and I am so sorry that I am not sitting down and talking to you guys to, like, you know, formally update you guys. But this is like the best I can do right now, is try to multitask, because that's really what nursing school is about. You're gonna be just multitasking all the time. So here's the thing. Don't mind me coughing, because I'm cleaning my bathroom and I don't like the chemicals. So anyway, so here's an update. I don't know what I posted on my last video. I haven't even looked. All I know is I have not updated you guys at all since I've been in nursing school, like at all. And here's the thing. All the stories that you've heard about nursing school being freaking hard as hell, all the stories are true. They're hard. It's hard as hell. It's really hard. As you guys may or may not know, I'm in an accelerated program. It's a part-time accelerated program. So I'm not, usually like most accelerated programs are a year long. There is a 1 year, there is a 1 year program at my school, that is 15 months. I don't know how those people do it. You're like literally signing your life away for that. Don't know how they do it, but I was actually signed up for that program, and I got put on the waiting list for that program, and they offered me the part-time program, which is 22 months. And I was like, I was really excited to just get accepted into nursing school to begin with, because I know a lot of people don't get accepted into nursing school because you really have to have like really good grades. And for someone who comes from like a art background, I had to literally just completely change careers. I had to do all those prerequisites from scratch. So very proud of myself to get in. So I decided, you know what, I'm gonna do the part-time program, because you know, I work part-time, and it might just be easier on me to just, you know, work part-time, be at school part-time, you know, whatever. So I joined the part-time program, and I started August 2020. And so, you know, this was still at the height of the pandemic or whatever, and so everything was online. And my first semester was something called 204, which is like nursing fundamentals. So in that course, you're literally just learning like the history of nursing, like vocabulary words and stuff, and like it's rigorous because my program is only 8 weeks, and you literally have to learn all this information in 8 weeks. So so yeah, I have 2 semesters and 1 traditional semester basically. So basically that program was literally all about like learning the fundamentals of nursing, like history, and it was a lot of memorization, but it was a lot of freaking information. I can't even explain to you unless you're like in nursing school. It's really difficult to try to explain to you how hard it is. A lot of people think like, oh, going and get your doctorate is super hard. Oh my god, you're a doctor, you went to 8 years of school. Listen, a nurse has to know what a doctor knows in 4 years. Okay? I might be wrong. I think doctor people on my channel who's watching this might like get mad at me saying that, but basically a nurse has to know what all the things a doctor knows. Like, of course we don't know how to, you know, do open heart surgery or anything like that, but we do need to know all the information doctors know, because we work very closely with a doctor. And if you hate me for saying that, I'm sorry. You know, that's just a general gist of what I'm trying to say, is that nursing school is very hard, okay? And if you have heard the stories, they're true. So my second semester it was like, I want to say it was like Foundations Part 2, but it was actually called something else. I forget. It was the class is called 202, and basically we started our lab. So we started learning how to do like Foley catheters, and was it Foley catheters? No, we didn't learn that. So it was basically a lab. So you basically had to learn like kind of like tech work almost, like what I do at my job now. I kind of had to like learn, so I pretty much knew everything. So how to empty a Foley, how to make a bed, like literally like what I guess technicians do or what CNAs do or whatever. That's pretty much what you learn. That's what I learned the second semester, which was from October to December last year, 2020. So I completed that. I did really well. A lot of people flunked out of that class. A lot of people didn't know how to do certain things, like it's not just like emptying the Foley. Like I can't remember exactly what we had to do in that semester, but there were some things that some people just didn't do well on. How to do vitals, like blood pressure, manually, and you had to make sure you did it right, and if you were off by 2 millimeters, you failed, and like they're very like very specific or whatever. So yeah, then my third semester, which was last spring, the first spring semester, I took Med-Surg 1. Med-Surg 1, I really enjoyed that class. A lot of people actually didn't like my professor. I actually loved her. I thought she was very knowledgeable. She made her own exams, so like anything she said in class, if you listened, you wrote notes down, you pretty much got it. Like I had a really good grade in that class. Did really well in Med-Surg. A lot of people don't do well in Med-Surg. I also did well because I work on a combinational floor. I work on a telemetry, which is like monitoring the heart / cardiology Med-Surg floor. So all the stuff that we learned, I kind of like was like, wow, like I seen that at work. Or throughout my semester, I would like see patients with the things that I was learning, which was really cool. So it was like almost like a second clinical for me being at work. So I really enjoyed Med-Surg or whatever. One, did really well, passed it. And then my second semester was Pharmacology 1 and Psych class. Now Psych, I took Psych in my undergrad at Parsons at because it was like an elective or whatever. We had to take some kind of like liberal arts elective or whatever. So I took Psych before, so I kind of had an idea. And also my mom was a Psych major when she was in college, so I always like, you know, knew some stuff about Psych or whatever. So nursing Psych is like, the fundamentals are the same, but it's kind of different because you have to know like nursing actions, which is a little different. Yeah, so pharmacology, I was really worried because I heard pharm is really hard. You literally have to memorize all these medications, and it's not just like memorizing vocabulary words. Like I feel like if you memorize vocabulary words, it's easier because at least you're like, oh, I'm learning a new word, I'm learning its meaning, and I can apply it to like what I'm learning. Learning medications is hard because you're not like using the medication in practice. So you literally, they give you like a series of meds in a subject, like let's say they give you a bunch of cardiac meds, and like they give you the beta blockers and then the calcium channel blockers, which are like types of cardiac medications, and they tell you like, oh well, beta blockers end in lull. So that helps. Like I would say my advice to you for pharm, because you'll catch yourself trying to memorize all the freaking meds. Do not do that. You will not pass if you try to memorize all the meds, because the meds are so, it literally looks like someone took a bunch of like letters and just threw them on a wall, and whatever stuck was the name of that drug. That's how they look. So it's really, they're hard to pronounce, they're hard to memorize because they're not like relatable words, because they're medications and they're like the generic names of the medication. So it's not like Tylenol, it's acetaminophen, which is like this long ass word, like, you know what I mean? So it's not helpful to learn the word. What's helpful is to learn the class of the med. So for example, like I said, if you're doing cardiac meds, you can remember like beta blockers all end in lull, and like certain like classes of medications end in a certain prefix, in a suffix or prefix or whatever. They have a certain prefix, so you can like remember what it's for. So like if the question is like, oh, Bob is having, I don't know, this is not a good question, but I'm just trying to give you an example. Like Bob, his heart is beating really, really fast. What possible med would you give? You would say like, if it said like beta blockers, GI meds, skin meds. Of course you're gonna know it's a beta blocker, which is a cardiac med, because his heart's beating fast, right? Now that sounds really like stupid and easy. That's not how they word the questions. Like I'm making it sound super easy, and I'm only making it sound easy so that you can understand like what I mean by like you have to understand the class versus memorizing the medication. But that's really like the easiest way I can tell you it would be to like literally learn how to like memorize the drugs versus actually memorizing each freaking drug. Do not do that. Let's see. So psych. Okay. After my Pharmacology 1 and Psych, that was my spring 2 semester. I had my summer 1 semester, which I took MedSurg 2. Now, y'all, I'm just giving you my experience, so here's my experience. My MedSurg 2 class was a shit show. I'm only saying that because we had our first real hospital clinical, and we had obviously MedSurg, and we only took that class, and MedSurg was worth 7 credits, so it was a big credit class. And I would say the first exam I failed it, which I hadn't failed any exams since, and I failed the first exam. The professor, the reason why I failed it was because she told us that you have to like adjust to your professors and get to like understand what they want and how they teach, because every professor is different. How they do things is different. I feel like I learn best if I'm going to listen to a professor and they say, hey, everything I say is gonna be the exam. I've learned that I do better with that, because if a professor I'm having is very knowledgeable on their subject and they're talking to you and telling you, hey, this is gonna be an exam, now I'm writing notes in class, that pretty much what they say in class is gonna be on the exam. But if they're a professor that is strictly by the book and they don't tell you that, you're gonna listen to everything they say, and then nothing they say is on the exam, but everything the book is. So like, for that class, she was very by the book. And of course you should always study the book, but I mean like she was like very, 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 very by the book. And she told us that everything she said would be on the exam, and everything she said was like an elaboration of what was in the book, based off her experience kind of thing. So I really took notes on what she said, and then what was actually on the exam was very by the book. And so I failed that exam. I was like, oh shoot, I think I got like a 76 or something like that, or 70 something, and you need a 77 to pass the course. So I was like, all right, I'm not gonna listen to what she says anymore. I literally stopped listening to everything she said. Obviously, I paid attention in class, but I didn't take notes and study based off what she said in class. I studied the book, and I got like 90s on the next 2 exams. So I was fine. Well, not like a 92, 94, something like that. So I did really well in the following exams, and I passed the course. So it was summer one. Now, the clinical of that was a shit show. Now, I'm calling it a shit show because, listen, I work, like I said, on a telemetry, med-surg, cardiology floor in a hospital, one of the most rigorous floors on the in the hospital. Like everyone, if you tell them you work on K8, they're like, oh, K8? Like, it's a really difficult, hard, fast-paced floor, okay? I'm just telling you, all right? You see a lot of stuff. It's a lot, okay? The nurses are like wise beyond their years. They're 1 year in meds, and 1 year as a nurse on my floor, and you're like a pro. I'm not even kidding. Like, it's a really challenging floor. And so, but everyone works as a team. Everyone's really cool with each other. There's no beef on my floor. I mean, if there is, like, it's not even, it's like maybe you just didn't misunderstood each other for some reason and whatever. But what I'm trying to say is that my floor is very teamwork oriented. Everyone's cool. I'm cool with everybody on my floor. I can't think of one person I don't like or anything like that on my floor. I really enjoy my floor as far as like teamwork. Everyone's so nice. But at my clinical, I really got to see the whole nurses eat their young situation that everyone talks about. Like, they were really like catty, and they talked shit about each other. They talked shit about us. They were really, they just like, for example, I was following a nurse one time, and we had just learned about tuberculosis medications. And there's a medication, tuberculosis, that's what it are, I can't remember it now. It's like risperidine, or I can't even remember the name of the drug, okay? All I know is that it makes your secretions turn orange, the drug. And so we had a TB patient, and I was like, oh, like, I'm always very wary of TB. I'm actually more afraid of TB than I am afraid of COVID, okay? And we were about to go into the room to give him his meds. So we were in the med room, and she was saying, I'm getting his meds out or whatever. I said, oh, is this the med? I saw the med name. I said, oh, this is the med that turns his secretions orange. And she was like, what? And I was like, yeah, the med that turns people's secretions orange. And she said, no, he's just Indian. I was like, whoa, wow. That was like an ignorant ass comment. And I was like, oh. So I was really offended, because as a person of color, I just found that highly offensive for someone in a professional setting to even say. But ignorance is everywhere. It don't matter. It don't even matter. And I was just really like turned off by that. And they all talked shit about each other. And our professor, like, she was great as far as a person. Like, she's a great person. And like, she explained things well, but she didn't have a control of the class, basically. And keep in mind, we're second degree people, so we're adults. And I think she like forgot that we were adults, and she got upset with us one time and decided to treat us like we were 5, and that did not go well. And it was like a whole situation, and it was just like, this is a mess. Like, what is going on in this class? Like, I'm so confused. And then the classmates had beef with each other. It was a mess, y'all. I was like, y'all, I am not in this, and I'm here to learn, and I'm minding my business. And I didn't, you know, it was just like a mess. I mean, I learned a lot, but that class, especially the clinical, I was so happy when it was over, because it was just drama. It was drama. And I was like, oh, this is what they talk about when they're talking about the nurses eat their young and the drama, and that's what they're talking about. Okay, well, I see it. I definitely see it. Whatever, I got through it. The second summer semester I had was Pharmacology 2 and Geriatrics. So Geriatrics, you have to learn the study of old people, which is interesting. I work on a floor where predominantly the people are older population. So, I mean, there are quite a bit of young people too. It's really like every age, honestly, but a lot of the people are older. So, I already like felt like I knew a lot of the answers and stuff like that. They do kind of try to, you know, trick you and stuff, obviously, but that class was fine. It was like one of those boring classes. It's like, ugh, I didn't want to take it. And then Pharmacology 2 was just like more of the same, just more meds. I actually found Pharmacology 2 to be easier than Pharmacology 1, probably because I already had an understanding of how the class flowed or something maybe, but that class was fine. And then my fall 1 class, my favorite, maternity. Oh my God, I was waiting literally. My entire nursing career thus far, up until that point, was based on going to maternity. I was like praying to God to have in-person clinical, because they were threatening to make us online. I was like, I do not want to have maternity online. I do not want to do those dumb simulations. Like, please, Lord, I do not want to do it. Please, 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 please. I really wanted to take maternity because I want to be a labor and delivery nurse. And I'm going to be a labor and delivery nurse right out of school. I don't care. So yeah, I want to be a labor and delivery nurse, and I really just wanted that clinical. And I really wanted this specific professor, because I heard that she was like the best maternity professor ever. Thankfully for God, it's in the stars, because she was my professor, and she was great, and I had an A in that class. Like, I did really well because I had a really strong interest in maternity. So took the class, got an A in it, did really well, learned a lot. A lot of stuff I already knew was just kind of like, what's the word? Not amplified. Like, a lot of the things I already knew was like affirmed more in that class, but I also learned quite a lot more. So it was a great class. I love that class. And then my clinical for that class was, it was okay. My professor, it was interesting though. My professor was a guy, which is funny because maternity is known to never have any, and so is mother baby, so is NICU, is known to like almost never have male nurses on it because they just don't have male nurses on it. Most women don't want, it's weird because a lot of women have male doctors, but they don't want a male nurse when it comes to like women's health or whatever, basically. He was a guy that had been working there. He said he was on his third career. He basically, his wife got pregnant, and he felt like the whole experience of seeing his wife have a baby and the whole pregnancy and the like delivery process like really inspired him to want to be a nurse. And that's literally how he got to be doing labor and delivery, and I was like, wow, that's cool. And so I was annoyed because he got me and one of the other girls in my class confused, and to Pierre and to come here, and I'm like, wait, but he wasn't looking at me, he was looking at another girl in the class as if he thought she was Pierre, and she saw him point to her and she got up and went with him as if her name was Pierre, and it wasn't. I was like, wait, didn't he say my name? I'm like, I'm confused. He put her in a room and she watched a live delivery. I was so pissed because I really wanted to see live delivery. So I was really annoyed by it. But you know what, the only thing about it that was okay for me though is that I've actually seen a live delivery before. One of my ex-friends got pregnant, let me see her birth, and it was a really cool experience for me. Actually, like, is what inspired me to want to be a labor and delivery nurse. And so I was like, you know what, it's okay for me to not, I really want to see another natural birth because it's a beautiful experience, and especially in a setting where I actually like know more of what's going on, I would love to see another natural birth. But what got me to, like, past being pissed off too bad was that I knew I had already seen one. So it was okay. It was like, you know what, because she was like, and I was also pissed off because she had said like, I don't even want to do labor and delivery, I don't really care for it, like don't really want to do it, had 3 kids, not really interested in, you know, watching someone else have a child, like I'm just not interested in it. She came out of that like, wow, that was the coolest experience ever. It's so different on the other end of the spectrum. Like when you're a mother, like you're in it, you're in a lot of pain, that's one side of it, but when you're like the nurse and you see the other side of it, it's like a whole nother experience. And she was saying how she, like, it changed her and made her want to be a labor and delivery nurse now. I was like, see, like when you watch a birth, it's like such a miraculous experience.